Okay, I think some people will start joining, but we can start and they'll join later. And we're also recording the session, so for anyone who's was waiting to come, we can send them through the recording and ask them not to share it. So first of all, thank you so much to everyone for coming. We're really happy that you can join us for this digital roundtable. We thought it's really, really important for us to be able to assess the impact of COVID on refugees and displaced people in the Kurdistan region of Iraq. So we work on the ground. Just to give you some intro of a background, I will be talking a little bit about the Lotus Flower and who we are and what we do. And then the team will take you through the actual assessment, the results, the impact, the next steps, and what's needed. So a little bit about the Lotus Flower. We are an organisation that supports women and girls that are impacted by conflict and displacement. We were founded in 2016, and since then we've managed to help 26,000 women and girls. And we work and support women and girls through community centres inside refugee camps, and we've got 6 pillars that we work by. So education, livelihoods, mental health, well-being, peace building, and gender equality goes through all of that, and human rights. So under those pillars, we have specific projects, and those projects are created in alignment with the community. So we work very, very closely with the community in asking them what their needs are. And we try and implement projects that are needed according to different areas and different regions of the camp and what their needs are. So for example, under education, we'll have things like adult literacy, computer courses. It can be anything educational. Under livelihoods, we've got many, many projects. We've implemented a women's business incubator program. We've implemented a cafe. We've implemented a bakery. So there's many projects in different areas. Today, we're going to be focusing on COVID and the impact of COVID. So I guess the first thing that we'll do is go into the context of COVID in the region, and I'll get Vian Ahmed to go into that. So Vian's our regional manager in Kurdistan, and she manages all the camps that we work in. So we have 3 centres in 3 different camps at the moment, but we're also active in 4 camps and in different regions and different parts of the region. We're also active abroad. So we work with Yazidi women in Germany, supporting them through, it can be legal cases, social cases. So we do work in different parts of the world as well, but predominantly in the Kurdistan region of Iraq. And so after the context, Crystal, who is our international projects manager, who works very, very closely with Vian on the ground, will be managing the assessment, will be discussing the assessment and how it was designed. And then Vian will talk through the process and how we actually implemented the assessment. And Crystal will take us through the findings and the next steps, and then Hannah will do the closing marks for us. So I hope that you find this fruitful discussion. Please, if you've got any questions, just answer them in the chat section. And then hopefully we'll be able to answer the questions in the end. And that's it. So thank you very much from me. I'm going to mute myself and let Vian talk. Okay, thank you. Oh, Vian, can you unmute?
Yeah.
There we go.
Yeah, thank you, Taban. Thank you, everyone, for being with us today. So as Taban said, before we get to the process of this assessment that we have done in our camps where we work, I would like to draw your attention to some of the context information of COVID-19 in Iraq in general, and specifically in Kurdistan and refugee and IDP camps. So as every one of us know that earlier this year, WHO declared COVID-19 as a global pandemic that's spreading in every corner of the world, infecting millions of people. And Iraq was, since the beginning, one of the countries that was suspected that this virus will be spreading inside the country, because because of its neighborhood with Iran, the country that since the beginning has a lot of confirmed and recorded cases of death and those people who are infected by the virus. So in February 24th, it was the first day that the first case of coronavirus was confirmed in Iraq. And at the beginning, there was not a relatively very low cases being confirmed by the government. That is due to the very strict protective measures put by the governments of, federal government in Baghdad and also Kurdistan Regional Government, which included the closure of airports, borders, closing schools, and also banning mass gatherings and mass celebrations that bring a lot of people together, and occasionally imposing lockdowns over the cities in case they see that it really needs. That was in the first lockdown happened here was in March, actually. So the 15 March was the first day of the lockdown in Kurdistan region of Iraq. Everyone has to stay at home. All the governmental and non-governmental institutions were closed. Even organizations that were providing services in camps had to be out of camp, and they were not allowed to go inside camps on daily basis because the doors of camps were closed, and people in camps were also not allowed to get out from their tents. And this restricted the number of activities that every organization is able to do. For example, for the Lotus Flower, we had to close our centers, and we were unable to do many of the interventions we did before the COVID-19 because of the risks that the virus might spread between the people when they came to our center. So as I said, these protective measures were set by the government, and people were really, I can say, listening to all of these orders that were given by the government. And this is why the number of cases that were recorded at the beginning were very low. But during the lockdown, the people have faced a lot of economical hardship, and this has created many issues for people, for them to think that actually there are other bigger issues than protecting themselves from coronavirus. And this pushed the government actually to lift the lockdown and to try to open borders. So they have decided that all the borders will be open and the airports will be open, and also let the people to get out from their houses, but encouraging everyone to wear masks. Unfortunately, this has led to a very big increase in the number of cases that since April until now, and the big number of death cases as well. So far, we have 80,000 confirmed coronavirus cases in Iraq with 3,000 cases of death. 10% of this number is from the Kurdistan region of Iraq. So since the beginning of this crisis in Iraq and in the region in general, the biggest worry was about whether what will be the situation if COVID-19 was spread in camps. And this is why Kurdistan Regional Government undertaken very strict protective measures in camps. So at the very early stage of this virus, so as not to let this virus to be spread in camps, because the health system might not be able to have all of this pressure. And since the camps are full of people, inside every one tent we have up to 10 people living in one tent. So it might be a disaster if it's spread in camps. And this is why the procedures within camps were very strict. Even organizations we are not allowed to enter camps unless there is a very critical health intervention that is provided by any health organization. Then in this case, they will let them know. But for other organizations, even if it is necessary, but it is not a health service, then they will not let them to be in. And this included us as well. This is why we tried during the lockdown to reach out to our beneficiaries remotely through phone calls and WhatsApp group to support them in the best ways possible. So this is in general, I mean, according to the situation of COVID-19 cases in the past few weeks, but for now, I mean, the current situation is that the government, as I said, has decided to open borders next week, to open airports as well. Mass gatherings are still banned to be happening, and also the transportation between cities will be open next week. But what is really sad is that there is a very big increase in the number of cases that are being recorded by both governments, in Baghdad and in Erbil. Number of confirmed cases and number of those who are dying from this virus is increasing very quickly in every city in Kurdistan and in Iraq. I will go to the impact of COVID-19. As I said, that the impact was very bad in a way that people could not, I mean, they were not able to even listen to the government orders when they were being asked to stay at home. And this is why we witnessed some of the demonstrations in some of the cities for those who are unable to stay home because they have lost a lot of jobs. And they prefer that they should go to their jobs instead of staying home and protecting themselves from virus. So the initial impact of this virus was, of course, that many people have lost their lives because of this virus, not only those who are aged, but youth as well in Kurdistan and in Iraq. And also a lot of people are being infected, so the hospitals are full. Yesterday, the government in Soleimani has decided that people who are infected by this virus, if they have no signs, then they should quarantine themselves at home because there is no more space for more patients in hospitals. So this is the, I can say, the initial impacts of COVID-19 on the health system in Kurdistan. However, there are other impacts of this virus on the lives of people. The first one was the drastic increase of domestic violence cases in Kurdistan, in Iraq as a whole, and also in camps. Every day during the lockdown, we were receiving reports about new domestic violence cases, especially against women and girls in the whole Iraq and also in camps. When we returned back to camps in May 2020, we also received these issues from the women who were coming to our centers to meet our psychologists or to meet our social workers at the center. The second impact of coronavirus, of course, was the economical hardship. So many people have lost their lives in Kurdistan and Iraq, and in camps, most of the people were daily workers. They were not employed. They did not have a business that they can depend on or to get an income from something that's sustainable. So they were all, the majority of the people, especially men, were daily workers, and they stopped working during the lockdown for up to 2 months. They were not allowed to get out from their houses and from out of camp because many of those were coming to big cities to work, but they were no longer able to do this during the lockdown. So the economical hardship was one of the very big impacts of COVID-19 on the lives of people, especially in camps, because they have very limited financial resources, or as I said, most of the financial resources for those people, for refugees and IDPs, depend on the daily workers who are coming to big cities to work. The other one is the lack of services in cities and also in camps. So due to the lockdown, most of the organizations and most of the governmental institutions had to leave the camp and to limit the services they were providing before COVID-19. And this had caused a big issue in the lives of people because they were no longer able to receive, for example, protection services as they did before. They were no longer able to receive food or non-food services provided by organization or shelter services. All of those were paused by some of the organization, and until now they haven't started to resume their activities in camps because of coronavirus. The other one was the other impact of COVID-19 that we have witnessed recently was actually related to the returning back of some of the internally displaced people from Sinjar, from IDP camps in Kurdistan. After the whole governorate office have decided that every person coming from Nainawa governorate, which includes Sinjar as well, should be quarantined for 14 days. This has led many families from Sinjar, were living in IDP camps in Kurdistan region to decide that they should return back to Sinjar, because the head of these families were working in the military forces or the Iraqi forces or other governmental institutions in Sinjar, and they were, before COVID-19, they were on weekly basis coming or monthly basis coming to visit their families. But after this lockdown and after these protective measures set by the governorate office in The Hague, those people were unable to see their families for months. And if ever they decided to come back, for example, to bring an income for their families who are in camps, they will need to be quarantined for 15 days, which is actually the amount of days they are permitted to come. So they had no chance to be able to reunite with their families, and this is why they decided to take their families back to Sinjar and return to their areas of origin. So this is the majority of those who have returned back. Some of those, so it's well known for many of the organizations, especially those who are working closely with the IDP community. This time of the year is a time where most of the families go to Nainawa to work on farms and sell the products to get an income and then be back in fall. But due to COVID-19, they were unable to have this transportation they were unable to mobilize this freely as they did before COVID-19 or last year. One part of the people who were farmers and were going to Sinjar in the past years to work and bring income for their families have also decided that they should go back to Sinjar. So these are some of the impacts of COVID-19, and I believe my colleagues will be discussing more about, for example, how financial hardship is impacting on the people, or mental health as well, and GBV and early marriage. So this is just in brief about what impact COVID-19 has in the IDP and refugee communities in Kurdistan.
That's great. Thank you so much, Vian. So next we'll move to Crystal, who's going to talk about the assessment design. Crystal, do you want to, are you on mic? So that's it. Yeah.
Yep, I'm all good. Thanks, Taban and Vian. Before we get into the findings, I want to talk about the design of our questionnaire and the scope of the survey, just to give a bit of background on how we did this. A general survey covering every aspect of life for refugees and IDPs across Kurdistan and the COVID area would have been incredibly valuable, I think, for all of us, but we couldn't do that under the constraints that we were facing. We went into this knowing that due to camp rules and safety protocols, we'd have a limited amount of time to talk to people one-on-one. We also have a limited number of staff to do this whole process. So we wanted to keep this in mind, and we wanted to stay focused. So that way we could also get through enough responses to provide statistical validity. As Vian mentioned, with informal conversations that our field staff was having with women in the communities where we work, there were very certain topics that kept coming up as area of concerns for more than one person. I've mentioned these included economic hardship, mental health, gender-based violence, and early marriage. So as part of our survey, we focused on these categories because we wanted to determine whether they were being felt systematically and whether there were differences between demographic groups. This kind of primary source data is absolutely vital to directing our work and our programming. So as we were designing the survey, we used a combination of qualitative and quantitative, but again, due to the limited amount of time that we had and staffing, there's a heavier emphasis on quantitative, which made up about 80% of our survey. We also collected demographic data from each respondent with their full permission. I won't read through the questions here, but if anybody would like them, we can make them available upon request. So this is just a very short overview. I don't want to go into all of the details with it. Vian will then discuss the process of doing the survey in the field, since she managed our whole team, and how it was conducted while maintaining COVID safety protocols. And then following that, I'll go through all of our key findings.
Great, thank you, Crystal. Let me spotlight Vian. Technology, don't you love it? Hi, Vianne.
Yeah. Thank you, Crystal. Yeah, as Crystal mentioned it, that over the course of, it was in May 2020, the first days of May, when us and some other organizations also have restarted their activities in camps. So over the course of 5 days in May, we started to do this assessment. The reason why we decided to do this assessment, it was not planned before, because we were not really thinking that the impact of COVID-19 will be this huge on the lives of especially women and girls. We returned to the camps and opened our centers, and we could see that a lot of women will come to us to report issues they are facing during COVID-19 and until now that are related to domestic violence, early marriage, and mental health services. So we were receiving everyday reports from the women, and even only in 2 months, we received 70 cases of those suffering from psychological problems or mental health issues due to domestic violence and other GBV issues they had during the lockdown. So our field team conducted over 300 questionnaires when we started to do this assessment in May, and one-on-one interviews in 3 different camps that were Rwanda camp and Asian camp. So Rwanda and Asian are 2 very big camps for internally displaced peoples, mostly Yazidi community. Each camp hosts over 15,000 individuals. And Dumis 2 camp, which is a Syrian refugee camp that hosts 9,000 individuals. The questions, as Crystal said, were a combination of quantitative and qualitative within the goal to gain insight into how coronavirus and quarantine affected the residents. We were unable to have group interviews with the people because of COVID-19, so we make sure that we are not causing any damage or any spread of the virus between our attendees, and this is why we conducted this assessment through community mobilization and house-to-house visits to meet the people. So it creates more confidential environment for women and girls, especially to be able to speak about issues they have faced related to domestic violence and early marriage. And as I said, we were able to cover 300 beneficiaries, and all of these beneficiaries were refugees and IDPs in 3 camps. 79% of them were women, 21% were men, 91% were adults, 9% were under 18. As I said, from refugee and IDP camps, 35% were refugees, 65% were from the IDP community, which are mostly Yazidi community in Rwanda and Asian camps. Yeah, over to you, Taban. Yeah.
That's great. Thank you so much. Crystal, can you take us through the key findings?
Yes. First, I just want to say, I want to express my gratitude to Vianne and our team on the ground. Under normal circumstances, they work under hard situations, and this is something none of us could have predicted. We certainly didn't think it would last this long or have the impact that it does. So we're really grateful to have them and their hard work. This is the data that we need for all of our community-led programming. So I just want to say thank you. Okay, so the first group of questions focused on economic hardship. That was definitely one of the key issues that came out of the COVID crisis. So 81% of respondents reported increased financial hardship due to COVID-19 and the subsequent lockdown. 46% were reported as unemployed, or they were supported by a family member. However, this did not include those who had a job or profession but were temporarily unemployed due to the crisis. So already there's long-standing unemployment within the camps. Qualitatively, we were told that most jobs were halted due to curfew and quarantine. Many salaries were cut, even when people still had to go to work, and many businesses had to close. In addition, many camp residents work for the NGOs that provide services within the camps. When the NGOs could no longer access the camps, unless they were like emergency medical NGOs, these jobs were terminated as well. Travel restrictions also impacted everyone, including essential workers, since they weren't allowed to leave. Students were impacted because schools were closed, and again, they couldn't leave the camps. Of those reporting that they did not experience economic hardships because of coronavirus, many of those were already unemployed. So technically they were experiencing economic hardships, but they had been experiencing them long term. The only occupations where hardship were not reported were doctor, peshmerga, driver, and daily worker. However, the last one is a bit of an anomaly, as other daily workers reported being impacted. The second area of the survey covered mental health. So 72% of respondents reported experiencing mental health difficulties, with 85% of those saying it had increased since the start of COVID. 80% of respondents said that access to a therapist by phone or online would have been incredibly helpful during this period. There's two really interesting points about these numbers. First, these are very high percentages generally speaking, which indicates a substantial need and desire for these services in the COVID era. Second, among male respondents, 88% said that online therapy access would be helpful. This is an incredibly high number, especially coming from men in this environment, and this is much higher than we were expecting. This is indicative of an underserved population, one where we speculate might feel stigma at utilizing in-person counseling services. Also, the relatively lower number of women, and again, it's not low because it was still 77%, but it was lower than men, said that they would like online therapy access. This might be reflective of the fact that in-person access is somewhat more available to them, and it's also one of the services that we currently provide. They might also experience difficulties in obtaining the privacy needed to utilize remote services at home, given that they are the main caretakers of the family. The qualitative responses we received when asking about mental health impact were a bit more opaque than in other areas. I just want to relay one indicative response. When asked about how COVID had affected the respondents' life and life in the camp in general, the answer was that it had, quote, affected all things. I just think that shows that COVID just affected every aspect of daily life, and that alone impacts mental health. So the third area of the survey dealt with gender-based violence and early marriage. 79% of respondents said that they or a family member had experienced GBV, with 89% saying that GBV had increased since the start of the COVID crisis, and 57% reporting that it's a significant problem. This is certainly a much higher increase than we were expecting, and it's quite alarming. So again, there was also a really interesting disparity here between male and female respondents, with 89% of men saying that they or a family member had experienced GBV versus 76% of women. We were quite surprised that women reporting this was lower than the men. The reason for this is unclear. There's possibly reluctance on the part of women to report GBV, given social stigma and pressure. But there could also be a difference between men and women in their understanding of what constitutes GBV. However, the encouraging interpretation would be that men in these communities are becoming more attuned to GBV and are reporting it more aggressively. However, the overwhelming number of respondents reporting that GBV has increased makes it clear that this is a major and worsening problem. On early marriage, 69% of respondents said that they knew girls under 18 who had gotten married, and 48% knew girls under 16 who had done so. 37% said this had occurred in the last 3 months, so essentially at the start of the COVID crisis in early March. When asked about the reasons for these early marriages, the primary reasons cited were poverty, lack of education, and the fear of losing family honor, presumably due to a combination of socially disapproved relationships outside of the traditional structure of marriage, but it's also the ability to resolve family debts through marriage arrangements. The COVID crisis clearly had a major impact on household finances, causing a rise in debt, which is frequently taken on by the male members of the household. To resolve these debts, young girls are provided as payment. This has an unavoidable link to GBV, as well as the cycle of poverty through generations. So after we had all of this data, we really wanted to come up with a solution, or at least steps to solutions to these issues. Our organization has worked in these communities for the past 4 years. So we have a number of programs that are already set up to address several of these issues raised in the survey. As was made clear by the survey, the demand has grown due to COVID, and we want to make sure that we're expanding these programs to help the communities where we serve. Thanks to the survey, we have some new ideas about how to further tailor and adapt the programs to meet their needs, such as the creation of an online therapy platform called Therapy Beyond Borders that is designed for those living in displaced communities and will allow people to access therapy remotely and in the privacy of their own homes. We also intend to increase our existing mental health support programs, including professional counseling with a university-educated psychologist, art therapy, yoga and mindfulness, and awareness campaigns, and direct community outreach. We've seen incredibly good results in terms of positive mental health outcomes, particularly when counseling has been supported by other indirect programs, such as art therapy and yoga and breathwork. These supplementary programs help to build community and reduce stigma attached to seeking mental health assistance. As Vian had mentioned, we've seen an increase in requests for professional support since conducting this assessment, and we want to make sure we're responding to the needs of our community. Poverty and lack of economic opportunity were also recurring themes in the response to the survey, so we want to increase the size and scope of our existing livelihood programs. This includes our very successful Women's Business Incubator and livelihood training, as well as support for our existing social enterprises like the Lotus Cafe and Baking Sisters. These programs have been incredibly successful at helping women establish financial independence and have been largely self-sustaining. But due to the unprecedented economic impact of this crisis, they naturally need help to restart. We also believe that there will be opportunities for new businesses in the wake of the crisis to fill the gaps left by closures of the old ones. Finally, with the rise in GBV and early marriage stemming from this, we want to expand our existing programming to address the heightened risks in this area. Even though there's better understanding of what is GBV and how to address it, the need for programs has risen. So we just want to make sure we keep this momentum. One challenge here is in raising awareness and providing support while avoiding the risk of large gatherings. But we've built good connections within these communities. We have amazing staff on the ground. We're confident in our ability to safely support residents on a safer and more individualized basis, and it will also help protect their privacy as we start to implement this advocacy campaign. So I'll hand it over to Taban, and we can open it up for questions.
That's great. Thank you so much, Crystal. So I think I'd like to most probably add a little bit to that, where thanking the team on the ground. They've done an amazing job just kind of keeping up with the constant lockdown, no lockdown. If you're in Kurdistan, you'll know exactly what's going on and how we've been changing and adapting. And actually, the way the team have adapted to it has been brilliant. When COVID first started and the lockdown started at the start around March, end of February, the first thing that they did was started distributing hygiene kits, which was really important, and then raising awareness with people in the camp, so not just women and girls, especially children, to stop the distribution of germs. And also our sewing sisters, so this is one of our income generating projects, our sewing sisters ended up making masks for those that are in the camp because the region had completely run out of masks. So initially we kicked off with those projects, and then it was locked down, so we were unable to do anything physically, but yet we didn't really let that stop us. We adapted very quickly. We had access to the community, therefore we had contact with them, and so we continued our awareness raising sessions around GBV, around hygiene, around mental health, around all these subjects, and we created WhatsApp groups which were all safeguarding. So you had men separated from the women, and we've got consent from all of them. So it wasn't just creating a mass WhatsApp group. It was very, very considered. And we continue to run the trainings through these WhatsApp groups, and the engagement has been absolutely phenomenal. And it actually shows the need of the community. We've got to remember they're all stuck in these cabins. We've all been stuck in our homes and our flats around the world, but these communities are stuck in tents or cabins, and some of them have at least 10 members of the family in one cabin. So to have that outreach from somewhere outside was very, very much needed. So I just wanted to highlight how we have adapted and basically customized with the current situation, and then still looking to improve further. And also, I guess the next stage is being more prepared and making sure that if something like this does happen, how can we adapt? And I think we have figured out a model and figured out a way of doing that. And I guess being so flexible, it's allowed us to do that. I wanted to open the floor for any questions. Does anyone have any questions? You can put them in the chat section if you do. No questions? Okay, no questions. So I guess if there's no questions, we'll go to Hannah to give us the closing remarks for the day. And over to you, Hannah. Oh, unmute yourself.
Thank you so much. So for anyone that missed introductions at the start, I'm Hannah. I'm a volunteer at the Lotus Flower. I've known Taban and the team for a number of years, and I've seen the work firsthand and can tell you really how incredible it truly is. We can't do any of this work at all without the funding in order to deliver it. So we can do the assessments to help understand what the significant needs are. And we've got 3 incredible women in Taban, Vian and Crystal who are designing and adapting and working hard night and day to make sure that we can adapt programs so that they're suitable for the people that need it most. But like any charity right now, and especially for a smaller local charity who's only been operating for a few years, the fundraising environment is really challenging for us. Bond, who is the UK's international aid organisation development committee, recently did a survey, and out of 116 NGOs, they predicted at least 50 wouldn't survive the next 6 months without additional funding. That's because of the free focus of many donors and funders, and charities having to stop some of their fundraising activities that they were doing before. We're fortunate that we do have a group of committed funders, but in order to deliver the mental health, livelihoods and SUV work we need to deliver, we need to raise a further $150,000 to deliver this work throughout the rest of the year. This is a minimum amount that will enable us to provide those activities and programs for over 500 beneficiaries across 3 different camps. But with further funding, of course, we'd be able to reach even more people that need us. This is actually a smaller group than we'd typically be able to reach with the same amount of money. The reason being is obviously it's important for us to ensure that we're working with smaller groups and that we're keeping those groups and our staff as safe as we possibly can. But as we hope restrictions ease, we'll be able to reach an even larger group of people. Within this amount of $150,000, it's broken down into 4 key components: 3 of our highest priority program areas, as well as core costs. So I just want to be really transparent about how those numbers are broken down. I know many donors and organisations obviously have their own processes and caps on, what they spend in terms of overhead. So I just don't want people to leave with any uncertainty about where the money's being allocated. So throughout the end of the year, it will be just less than 20% that's spent on our key staff. That's the 3 amazing women that you see on this call today, as well as some other great minds that are supporting us on the ground. Obviously, without these 3 women, there are no programs. There's no one to design or to deliver them. You know, they do an incredible amount of work, and the direct implementation just simply couldn't happen without them. The other key areas that we're looking to invest in, of course, is mental health. As you heard from Vian and Crystal in particular, the need is huge, and we need to be able to provide them not just with psychologists, and we would be able to provide 2 psychologists throughout the end of the year with an extra $33,500. But we also want to provide them with art therapy, yoga, and awareness raising. As Crystal was mentioning, you know, breathing activities and other types of stress management and bringing communities together, as well as raising awareness about the challenges with mental health and the services that they can access is hugely important. The other area would be livelihoods. So we'd be looking to invest around $67,000 in this. We particularly need to provide grants to women to help them to restart their businesses. As you heard, we already had successful women's business incubator programs supporting women to start a bakery and a cafe and other businesses that serve not just the women who are running the businesses as a form of income, but also hugely benefited the wider community as a whole. So we don't only want to give grants to women in one of our camps in Rwanda, where we're already operating, but we also want to provide grants to women living in SEN and DOMAS camps. The other core area of work, as you heard, is sexual and gender-based violence and early marriage. We've obviously heard the very alarming stories about young girls being sold to pay off family debt. And you know, poverty amongst other factors driving that early marriage statistic up. So of course we want to be able to invest further into awareness raising sessions and psychologists and continuing our door-to-door outreach across all of our 3 centres. So that would cost another $22,500. I know many donors, of course, have their own programs and processes, but for those of you that do, please do keep us in mind if you have any upcoming calls for proposals. And we would also really appreciate everyone keeping us in mind if you have any individual donors or trusts or foundations who you think might align well with the vision and mission of the Lotus Flower. We'd love to follow up with you all after today, just to reach out again to clarify some of the information that we've shared, and again to ask if you're able to introduce us or support us directly. We would be, on behalf of the women and girls we support, incredibly grateful. So thank you so much for all joining us today. I'll pass back to Ban to say any final words.
Thank you so much. Thank you, Hannah. Okay, I think we've kind of, so I just wanted to say a massive thank you to the wonderful, wonderful team. They do an incredible, incredible job, and actually none of this would happen without them. So I personally am very, very grateful. We just all want to be able to impact more lives. We can do it. We've got the model, we've got the setup, we've got the infrastructure. We know exactly what we're doing. We just need support to reach more people and continue our projects. And I hope that this this report and the assessment has been insightful and informative for you all. I don't think there is a lot of information out there in terms of the impact of COVID on refugees and IDPs. So conducting this has been very, very important. I hope it's been useful for you. As Hannah said, we would love to follow up with you and see further if there's any ways that we can support each other. We definitely need the support. And if there's any questions, let me know in the chat. If there isn't, thank you so much. Okay, brilliant. Thank you, Farah. Thank you so much. Yes, so we will be following up with you. Thank you so much again. Thank you to the lovely team for putting this assessment, this roundtable together. And that's it. Thank you all.
Thanks, goodbye.
Thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Bye.
Bye. Thank you.